Assalamu alaikum dear viewers. In this video I am discussing about toxic shock syndrome TSS. First about pathophysiology, how it developed. In toxic shock syndrome, shock triggered by superantigen exotoxins from Staphylococcus aureus or group A Streptococcus. Remember, Streptococcus and Staphylococcus. This is the main microorganism responsible for toxic shock syndrome develop. Now, more commonly due to spread from skin or soft tissue infection or tonsillitis previously from superabsorbable tampons. Differs from septic shock in its pathophysiology, exotoxin mediated and management which may involve IV immunoglobulin in addition to antibiotics. So, in toxic shock syndrome patient, previously or past there is presence history of and this spread from any skin or soft tissue infections or tonsillitis history or previously from superabsorbent tampons. Tampons users toxic shock syndrome risks. And its important pathophysiology is it is exotoxin mediated and management is involving intravenous immunoglobulin in addition to antibiotics. Now about signs and symptoms. In toxic shock syndrome patient may present with there is systemic blood pressure less than 90, temperature more than 39 degrees Celsius, that is high fever and hypotension. There is rash present, blanching rash, example with a handprint. Macular erythrodermic rash including on palms and soles. There is discommotion occur 1 to 2 weeks later and strawberry tongue. Multi-organ failure, as it is a shock, there is confusion, diarrhea and vomiting, liver and kidney failure. So, in toxic shock syndrome patient history, that is the patient has pastly any history of soft or skin tissue infections, tonsillitis or previous any menstrual history, the patient is using tampons, then sudden develop these clinical features and toxic shock syndrome is developed. Now about investigation. What investigations we do in toxic shock syndrome? There is full blood count, WBC, there is decreased platelets, thrombocytopenia, and we are seeing that there is blanching rashes also present. Urinary and liver function test for sign of organ dysfunction, cultures, blood, tissue, blood culture often negative as disease is due to toxin, not bacteria. Remember, toxic shock syndrome is associated with toxin. Clotting may be deranged if there is associated DIC. So, disseminated intravascular coagulation is also developed in toxic shock syndrome, though clotting may be deranged. Now about management. This is very much important. We manage toxic shock syndrome or TSS by clindamycin. IV has antitoxin effects. Remember, why use clindamycin? Because it has antitoxin effect in toxic shock syndrome. That's why we use clindamycin. And in severe cases, we use intravenous immunoglobulin. So, this is all about toxic shock syndrome. Please do subscribe and share Dr. Amma's Medicine YouTube channel. Thank you.